Okay, welcome back. Today I'm going to cover a very exciting and interesting topic that is botulinum toxin, also goes often by the name of Botox, which is a brand specific term owned by the AbbVie Allergan Corporation. So when we talk about botulinum toxin or Botox, how was it originally discovered? It was actually discovered in the early 19th century when groups of people went down with horrendous food poisoning and fatalities after eating sausages. And it took 100 years to isolate what this sausage-borne disease was, to understand it was actually a toxin in the sausages. And it was given the term botulus because that's the Latin for sausage. So botulinum toxin is all based on the discovery of toxins in sausages. One of the characteristics of the food poisoning that sausages gave was that people were paralyzed. And a genius ophthalmic surgeon called Alan Scott in Vancouver in Canada used this ability for microscopic amounts of botulinum toxin to reduce muscle movement in patients who had squints, where overactivity of certain muscles led to visual distortion. He worked with somebody called Carruthers, another very gifted oculoplastic surgeon who was married to a dermatologist, Carruthers, who very tragically passed away recently. And over supper one evening in Vancouver, Jean explained to Alistair that some of her patients were insisting that she gave them their squint injection again and again. And this was due to patients noticing that not only was their squint better, but the lines around their eyes magically smoothened. And being the clever people they are, the Carruthers realised that this same injection might be useful in cosmetic practice for softening movement-associated lines. And so the early use of botulinum toxin in treating skin-associated wrinkles was born. So how does botulinum toxin work? It works by interrupting the release of a particular chemical called acetylcholine from the ends of nerves that join with muscles. That's why the muscle movement is reduced. And the same nerves also induce the secretion of sweat from glands, which is why botulinum toxin is also a miraculous treatment for excessive sweating. And also the same nerves release certain inflammatory chemicals in the skin. So Botox can be used to help with certain inflammatory conditions in the skin. So it's really a miraculous pharmaceutical product for treating a whole range of problems that we have in the skin and beyond. One of the main problems with botulinum toxin is it's become so popular that people have started ordering it over the internet. And there's no clear quality control on some of the products that you get through ordering on the internet, so-called grey products. And this has led to an outbreak of people being inadvertently overtreated or paralysed in various parts, subsequent to having what we call knockoff Botox. So it's really extremely important that you check on the skill base of the practitioner who might inject you with botulinum toxin. The other main side effect, other than inadvertent paralysis, which is a pretty serious complication, is that if it's not used carefully for muscle balancing purposes, you can end up with aesthetic outcomes that you absolutely don't want. Hence all these characteristic bad photographs of people looking shocked or looking like they've had a stroke, all these sorts of things. These sorts of outcomes fortunately do reverse over the fullness of time, but you don't want to find that out after having visited an intensive care unit requiring ventilation for a few weeks. So choosing your practitioner and the skill of your practitioner, both medically and aesthetically, is absolutely crucial. Because it's so useful in helping with certain movement-associated lines, people often wonder, should they start using this in a preventative fashion rather than waiting until they actually develop movement-associated lines. And there's no question that Botox can actually be helpful in stopping movement-associated lines kick in. But unless your professional life involves you standing in front of high-definition cameras such as this, it's usually a treatment that is good to use after you've been using active skincare and sunscreens for several years. As such, if you look at the statistics, it's really most used early on in people in their mid-30s, but you can use it earlier if you particularly need to, unless your career is dependent upon high-definition videography, in which case you might be a little bit more sensitive to the early development of wrinkles. Of course, for all of us, the mention of injection strikes fear in lots of us, and it would be wonderful if we had a topical version of botulinum toxin that could be applied either in the doctor's office or at home in a cream. So a vast amount of money has been spent on trying to develop a topical form of botulinum toxin. And the biggest amount of research was done by the Revance Corporation. But in 2016, their product that looked very promising, RT001, was actually discontinued in phase 3 clinical studies because the results were just a little bit too subtle for patients to go through. And work continues trying to develop a good topical treatment, but there are problems getting a large molecule like botulinum toxin through the skin down to the nerve-muscle interface where it actually works. So there's no topical products breaking ready to use. There are, of course, botanical and certain peptides which in laboratory studies can show some subtle effect on nerve-muscle interaction, which the companies like to purport as being a great Botox-like effect. But you can't get a effect anything like injectable botulinum toxin for any product that you're going to buy across the counter. So its main clinical uses are, of course, changing muscle balance in the face, for which it's most famous for, and that needs to be repeated approximately every 4 months. The other transformational effect of botulinum toxin is in the 5% of people who have normally elevated levels of sweating, often emotional sweating. And for those who sweat very easily under the armpits staining clothes, or from the forehead pouring down on the face, or from the hands wrecking notes that they might pick up in a business meeting, the use of botulinum has actually been transformational. Often it lasts a little bit longer in those scenarios, 6 months, and after a while, sometimes you can extend that out to a year. The other great use for botulinum toxin is as an anti-inflammatory agent. And in certain skin conditions such as rosacea, where you may have increased sweat output on the face, increased redness output on the face, and increased sebum output on the face, injections into the dermis of the skin with botulinum toxin can produce a very effective impact on the skin. So viewing Botox as a purely cosmetic, trivial intervention misses the point completely of this pharmaceutical agent, which in educated hands can be transformational for so many patients. Its risk to benefit ratio is uniquely optimal for Botox, which is why I'll give it a 10 out of 10 score on how good do I think it as a product for treatment on patients. In carefully selected people, it really changes lives, and other types of treatment that dermatologists use are really trying to play catch up with the risk-benefit ratio of botulinum toxin. For sure, it's the world's deadliest poison, but when used in minuscule amounts in educated hands, it really is as close to as a miracle as your dermatologist gets. So thanks for watching. It's obviously a huge area, botulinum toxin. Patients have always got thousands of questions. So like, subscribe, post questions, and I'll get back and react to as many as I can in subsequent videos. It's most important that you feed back to me what really matters to you in these subjects, not what I think matters to you. So do leave comments and I'll try and react to as many as possible. See you soon.